Hey, welcome to the Keto Edge Summit. I'm your host, Dr. David Jockers, and I'm here actually with a great mentor of mine, Dr. Thomas Seyfried. And here on the Keto Edge Summit, our goal is really to help dispel the myths and empower you to improve your health and your life using a keto edge or ketogenic lifestyle. And so Dr. Thomas Seyfried actually wrote the book, The Metabolic Theory of Cancer, and you were a professor and a researcher at Boston College, is that correct?
That's correct.
Yep. And tell us about how you got into cancer and cancer research to begin with.
We've always done work in lipid metabolism in cancer. And basically, it's purely academic.
Yeah.
But we also did a lot of work on ketogenic diets for epilepsy, and one thing led to the other.
Yeah.
And then we realized that you could shrink tumors by depriving them of their fermentable fuels, which then put us on the pathway to manage and try to resolve these cancers.
Yeah.
So it came through basic academics, through epilepsy, because the ketogenic diets have been used in epilepsy
for epilepsy
years.
That's where all the beginning research was. Yeah.
Beginning Wilder at Mayo Clinic.
Yes.
Back in the 1920s. But we have models for epilepsy, and we were finding that these ketogenic diets are spectacular in reducing seizures.
Yeah.
And they reduce seizures by lowering blood sugar and elevating ketones.
Right.
And then it became clear that the cancer cells need that glucose, and the same strategy could be, it's even better for cancer than it is for epilepsy.
Yeah, absolutely.
So, and the mechanism is so much more clear for how those reducing glucose and elevating ketones actually manages cancer. We don't know how that manages epilepsy.
Right,
so
we're still trying to figure that out.
Future research for the next 100 years.
Right.
But for cancer, it's clear, and we know how to exploit that.
Yeah. Yeah, and Otto Warburg, right, originally kind of pioneered the idea, right?
Yeah, he showed that cancers are fermenting.
Yes.
Okay. What he didn't know is they also ferment amino acids, which we now know, and we're doing that work. But basically, Otto Warburg was correct. Regardless of what people want to say that he didn't know, he was correct.
Yeah.
Absolutely.
Because he has a lot of critics, right?
There's a lot of critics. Well, they said that he was wrong.
Yeah.
This, but he was not wrong.
Yeah.
Because if Warburg is correct, then most of what we're doing for cancer is incorrect.
Yes.
So therefore, you have to say that Warburg is wrong to preserve your own field.
Right. Absolutely.
But Warburg was correct, but he didn't have all the parts to the puzzle.
Yeah.
We're putting those parts together now.
That's right.
Extending his work to where it really leads to the resolution of the disease.
That's right. And so for the listeners out there, when he was talking about cancers, they ferment, basically they break down sugar, and we also know now amino acids like glutamine, right? They break this down. That's their fuel source, okay? And they run that through glycolysis.
And glutaminolysis.
And, exactly.
So you have these two fuels coming into the cell. And all or nearly all cancers are the same disease. Yeah. So when people have to realize that, they all think cancer is 100 diseases. It's very complicated. It's not complicated. It's a single disease.
Right. It's a metabolic disease.
All works, or the same therapy will manage most cancers.
Yep.
And that's a hard pill to swallow for so many people. Yep. Institutions, private foundations, they say, my cancer is different from your cancer. No, that's all the same.
Yeah. And so tell us about some of the different components between like a normal cell and a normal cell's metabolism, and then a cancer cell and its metabolism.
Well, all of our cells in the body respire. That we use oxygen and we produce water and CO2. The cancer cell is different because they have a defect in that capability, which is the mitochondrion, basically. Yeah. And so if the cell is going to survive, if it's not going to respire effectively, how does the cell live? Yeah. The single largest consumer of energy in any one cell is a pump on the outer surface of the membrane. And those pumps maintain the gradient, which is life. Yeah. And when the pumps run out of energy, the cell dies. Yeah. So you have to have energy for the pump. So if you're not respiring to get energy, where did the cell get the energy to survive? It ferments, falls back on an ancient pathway, and uses these fuels in the environment, glucose and glutamine, to generate the energy for the pumps. The problem is these cells now become dysregulated in their growth. Yeah, when you fall back on this ancient pathway, the cells also fall back on what they did, which is proliferate. Right. So essentially you have a fallback on an ancient pathway that's been in evolution for eons. Yeah. So these cells are basically fermenters. And as long as the fermentable fuel is available, they will live. It's very hard to kill them without, and that's why they keep coming back. They're resistant. Well, you're not taking away the fermentable fuels.
Yeah,
So,
absolutely.
and the more toxic drugs you give to the patient, more radiation, frees up more fermentable fuels.
Right.
So you actually contribute to the success of the disease by using some of the techniques that we're using in the clinics today.
Right.
Consequently, we have 1,600 people a day dying from cancer.
Yeah, crazy, absolutely.
It's not a, it doesn't have to happen.
Yeah, and most oncologists have no idea about this. If you were to go to them and say, hey, does sugar cause cancer?
Well, it's not their fault.
Yeah.
They're not trained to do that.
Very true.
Okay, their educational process is missing the most important components.
Right.
And if they're not ever trained to do this, and they're trained to do only certain things, they must think that is what works.
Yeah.
But so this is we have a vast absence of knowledge.
Right.
Okay, and they're not trained. So what do? You go to those guys, and they're going to give you radiation and chemo and radical surgery because that's all they know what to do.
Yeah.
They're not bad people. They're people. They're interested in the survival of their patient.
Absolutely.
Using the tools that they were instructed to use. But they were never instructed to use metabolic therapy.
Yes.
So you have this missing link.
Yeah, and metabolic therapy, if a knowledgeable oncologist understands metabolic therapy, they can use something like a chemotherapy more effectively, right?
Well, they could.
Yeah.
The problem was when you go down that path, you are now at odds with the recommendations of the AMA.
True.
In treating patients, and they fear that they could lose their license and they could be ostracized from the group.
Yeah.
Even if they want to do this, they're restricted from doing it because it's not sanctioned.
Yeah.
So then you have to go to a higher level. Why are they not sanctioning this?
Right.
Then we get into big other issues.
Yes, absolutely. And so with your research, what sort of models are you looking at, and what have you found as you go deeper with your research?
Well, we've developed some of the best models for metastatic cancer and glioblastoma.
Yeah.
So
glioblastoma is a brain cancer.
Yeah, it's
really growing, very popular.
It's a very devastating.
Yeah, it is. I've had many patients with it. Yeah.
And unfortunately, it's the standard of care that basically is responsible in large part for the demise of most of these patients.
Yeah.
It's a tragedy.
Yeah.
So, and the ones who go metabolic do much better.
Yeah.
So, but it's very hard to break into that mindset.
Right.
And you're right. The surgeons are unfamiliar with this. The neuro-oncologists.
Yes.
But it's not only it's like breast cancer, colon cancer, every kind of cancer.
Yeah.
They just don't know.
Yeah.
They hear about it, but they can't implement it because they're not sanctioned to implement it.
Yeah.
So we have a problem, a huge problem for all these cancers.
Definitely. And so when you're putting somebody into a therapeutic ketosis for cancer, right, in your research, what have you found as far as blood sugar, kind of where we want to keep that blood sugar, where we want to get those ketones up to?
Well, we published a paper on the glucose ketone index calculator, which allows everyone to know where they stand with respect to therapeutic ketosis. Right. So people ask me, can I eat this? Can I do that? And the answer is, well, measure your index.
How your body responds. Yeah.
How your body responds. What's your index?
Right.
So if you're 1.0 or below, you're doing well. You're in therapeutic ketosis.
Yeah.
So if you eat this and you fall out of therapeutic ketosis, don't eat that.
Right.
Right? And it could vary from one person to the next.
Yeah.
Like what you can eat, this other guy can't, and vice versa.
Yeah.
So you just measure it. So then you have a hard biochemical marker to let you know whether or not you can be eating that or doing this.
Right.
Okay. And there's a new app that just came out called Heads Up Health.
Yeah.
Where they adapted the glucose ketone index together with what a person would do on his daily life.
Yeah.
Exercise, what he eats, what he does all during the day, measuring his index. It was made for cancer patients originally, but now we find all these normal, healthy people who want to stay in ketose and not get cancer are using the same app. So it's kind of interesting.
And it looks at that glucose ketone
it looks at
index.
the index, but also what you're eating, what kind of exercise you have, what your days, parts of the day where you don't do anything, so it regulates your whole activities in your body related to therapeutic ketosis.
Yeah.
So then you have a clear idea of what your body is experiencing over the course of days and weeks and months. So it gives you a kind of a report card on your body's health status.
Yeah.
Which is really quite it's a very empowering.
Yeah, so helpful, absolutely. Yep. And so obviously there's lots of research coming out on ketones and their ability to help improve brain function, all different components like that. And so as far as that goes, what are we finding out just about beta-hydroxybutyrate, maybe epigenetically? Are you finding anything?
Well, of course, when you go down to the academic level, beta-hydroxybutyrate is a histone deacetylase inhibitor.
Yep.
And they have toxic drugs that do that.
Right.
The question is, how high do you have to get your ketones to have inhibit histone deacetylases? And the answer is we're not really sure.
Right.
Okay. So this is a wonderful path to follow in academic medicine.
Yeah.
But the patient with cancer or Alzheimer's disease or something, they're not really interested in histone deacetylases.
Right.
They're just interested in trying to keep the tumor at bay or keep whatever cognitive function they have remaining.
Right.
So this is a different issue, and they want to know what I have to do to stay in this zone so I don't go down faster than I'm on this path.
Yeah.
So they want to stay healthy. But the academic is more interested in the molecular mechanisms by which beta-hydroxybutyrate may not only target and restrict cancer growth, but also maintaining cognitive acuity in your brain and brain cells and things like this.
And I know in your book, Metabolic Theory of Cancer, which really made a huge impression on me.
Well, cancer is a metabolic disease.
Cancer, Cancer as a metabolic disease,
but it is
where you outlined the metabolic theory of
Right,
cancer.
right,
Absolutely.
right.
That book really had a big impression on me when I first read it. And as a functional medicine practitioner.
Well, it had a big effect on me writing it.
I imagine.
In fact, sometimes I don't even know who wrote that book.
That's funny. And so, and this book is like the textbook for how a ketogenic diet or ketosis really impacts these cancers and ultimately how cancers run off fermentation like he's talking about. Great book to get, especially if you're out there and you're a healthcare practitioner. I would definitely recommend getting a book like this and really diving into it because you'll see all the research outlined in that, and it just goes in depth, and it also helps support your research, right, and whatnot. So anyways, getting that would definitely be great. And in that, you kind of outline like how to put somebody in ketosis, using basically a nutrition strategy, and in a sense, it was kind of a calorie deficit for a period of time.
Well, we're at first that was the draconian approach to this.
Yep.
Just bite the bullet, stop eating.
Right. It was more challenging.
Hard. Yeah. It's very hard. Yeah. Anybody who's tried to go on water only fasting for several days, because your brain is addicted to glucose.
Oh yeah, exactly.
And you have the same withdrawal symptoms as if you were addicted to alcohol, cocaine, or whatever.
Yep.
You go through malaise, you get tired, fatigued, sometimes lightheaded, and this is not fun.
Yeah.
However, we're learning from all these patients and people that are doing this, feeding back information, how to make that transition a little bit less difficult. So I was speaking to someone the other day, and they said, well, what I do is I stop eating for just 24 hours, which is most people can do.
Yeah.
And then take some ketone supplements.
Right, so exogenous ketones.
Exogenous ketones, and brings us up, and then I take those, he says, I took those for a couple of days, and then stop eating. And he says the transition, when you're already in ketosis to a therapeutic fast, the transition is much easier.
Oh yeah.
You don't feel so, debilitated.
Yeah, because those exogenous ketones give you that natural satiety.
That worked for him. Other people say, no, I'm biting the bullet right away, I'm just going to stop eating.
Yeah.
And then the older you get, the longer and more difficult.
Yeah.
Without practice, it is to get into these zones.
Yes.
Believe me, kids, young people in their 20s and early 30s and teens,
not as metabolically damaged.
No, they're able to get into this.
Yes.
It's doable but uncomfortable.
Right.
But if you're in your 60s and 70s, you try to do this, man, this is like trying to break an alcohol or drug addiction. It's not easy.
Yeah.
Your body has been so accustomed to glucose for so long. It's much harder. But you can do it, but it just requires a lot more power on the part of the person. A lot more,
absolutely.
Discipline.
Absolutely. And so, typical, the way I've learned it, typical nutritional ketosis is really between 1 and 3 millimolar, somewhere really 1 and maybe up to 7 or so. And so for therapeutic...
That's all in the therapeutic range.
That's in the therapeutic range?
And then if you did your blood sugar measurements and you found your glucose to be in the around 70 or 80 milligrams per deciliter, you convert that to millimolar and you do the ratio.
Right.
And you're pretty close to 1 or below 1.
Yeah,
so you're in the therapeutic, you're in the zone
in
of
that therapeutic
Once you know what the zone is, then you can work to get to that zone.
Right.
Right? So, but people doing it on their own without knowing the index. Oh, I'm in ketosis. Well, how do you know? I peed on a strip and it told me I was.
Right.
But that's not accurate. You got to have the blood ratio.
Yeah.
That's the accurate way. Then you know for sure you're in therapy.
And you said that blood ratio is 1-to-1?
1-to-1 in millimoles.
Yes, in millimoles.
Because a lot of the glucose meter give you glucose in milligram per deciliter.
Yeah, exactly.
Okay, so what's that?
So if you had 70
so you have
over
to divide
3,
that by 18,
yeah, exactly.
and then get millimolar, and then make the 2 divisions. A lot of people, they just want to push a button and get the number. They don't want to do this arithmetic.
Yeah.
You know, it's very simple. But the calculator does all that for you.
Yeah, exactly.
You know, so you just have to get your numbers. You put it into the calculator, and there's your zone.
Absolutely,
right there.
absolutely. And there's a big difference between a 70 milligram per deciliter blood sugar for somebody that's keto adapted and somebody who's not, right? So you hit 70 and you're not keto adapted, you're going to have hypoglycemic responses.
Well, actually, if you're in ketosis, you're not going to have any.
Not if you're in ketosis, but
if you were to drop your blood sugar, say you take insulin,
right?
You'd go unconscious.
Yeah, exactly.
You'd have a seizure.
Yes.
It's a life-threatening condition.
Absolutely.
All right, but if you're in therapeutic ketosis, you can push your blood sugars way down.
Yeah.
You know, Dom D'Agostino, my friend, got it down to 25 milligrams per deciliter.
Yep.
You know, a 4-day fast with ketone supplement, and he was able to push his blood sugar to 25 milligrams.
So he did that with just a fast, along with exogenous ketones. Wow.
With exogenous ketones.
Yeah.
And he took a photograph of the meter to let me know what the number was.
It's legit.
Yeah. I mean, so I know you can do it.
Right.
And I said, how did you feel, Dom? And Dom said, I feel spiritual. So
yeah, because I mean, just those ketones, I'm sure were super high. Yeah.
But you know how you can't do that for very long. But there are some people who can always remain around 1 or a little above. When you go to those extremes, you're down well below 1. You're down to 0.3, 0.4 range.
And that's not really sustainable long term.
It's hard to do that.
Yeah.
It's hard to sustain that. I don't think most people want to sustain it.
Yeah.
I mean, you really have to be very disciplined and compliant to do that. You more or less have to drop out of society to stay in those zones. But if you have a disease like cancer, the longer you can remain in that zone. And don't forget, we add on drugs and other procedures. So once the patient is in that zone, those tumor cells become extremely vulnerable.
Right.
To low dose
because they can't produce glutathione.
No, they become, they're sitting ducks, basically. For any other things that we apply.
Right.
Hyperbaric oxygens, these
exactly.
slaughter those tumor cells.
Yep.
But you got to be in that zone to have that effect.
Right.
If you're not, then this other stuff doesn't work.
Yeah, I know in my clinic that's what we do is ketogenic diet, so restricted ketogenic diet, hyperbaric oxygen. It seems to work great.
Oh boy.
Right? We'll do some nutritional supplementation and things like that as well. But you're right, and then if somebody were to go a conventional model, right, adding in that chemotherapy now.
We use very, very low dose.
Yeah, low dose, because you don't need as much.
No, you don't need as much. And we're showing that too. We get through the blood-brain barrier. We can ketogenic diets facilitate drug delivery through the blood-brain barrier.
Yeah.
I mean, it's amazing.
It's incredible,
So unfortunately, it's not being used in medicine.
Yeah.
You know.
Well, thank you for being a pioneer and leading the research on that, because ultimately that's how we get things into modern day practice is lots of research and continually proving that it's working.
Well, we have the preclinical systems that allow us to validate and vet some of these things.
Yeah.
So after we do this, and this is where the research money comes in.
Yeah.
Because it costs a lot of money to do these things.
Absolutely.
But you want to be sure that if you're taking a new therapy, you're not going to harm yourself.
Right.
Right. So you have a preclinical system that tells us that this is really effective. It's not harming the subjects, and we think just with a few changes, it would be easily adapted to the human, and generally that's what we find.
Yeah.
You don't want to be taking stuff that you haven't vetted in the preclinical system because you could potentially harm yourself.
Yeah.
And you know, so you really have to have that knowledge, and that makes everyone feel a lot more comfortable.
Yeah, absolutely. And what are your thoughts on exogenous ketones and using those to help people get into therapeutic ketosis?
I think they just get themselves into the zone. And then take the exogenous ketones and see whether or not they stay in the zone. What does it do to their zone?
Yeah.
Do it naturally first.
Right.
Then take the ketones.
Yeah.
Because they're not all the same.
Yeah, it's
some
true.
of them have sugars, some of them have a lot of salt, some of them have a lot of different components.
Yeah, exactly.
You don't know what those components are going to do to your physiological state.
Right.
So the way to do that, you put yourself into the zone, then take that brand of exogenous ketone and say, does it lower my zone, or does it throw me out of ketosis?
I see. Yeah.
Right? So even so, it says ketones. Well, how come my blood sugar's going higher?
Yeah.
Don't use that. It's very simple.
Absolutely.
As long as you have the knowledge to know what your body is doing, where it is, you know that taking this or that will have an effect.
Yeah.
Just like we learned from taking dark red wine and expensive champagnes. You know, the highly expensive French small bubble champagne doesn't throw a lot of people out of ketosis. It's good to know. Right? Dark red Burgundy wines. White wines you're throwing out, beer you throw out, so you know what you're capable of doing.
Right.
People need to know that so they can be participant in life.
Right. Yep.
So
yeah, makes a lot of sense.
That knowledge is important for people.
Yeah, definitely. Now, you talked about L-glutamine as a fermenter as well, or glutamine, I should say,
glutamine,
in the amino acid in the body.
Yeah, glutamine comes in, it's broken down to glutamate. Glutamate goes into the TCA cycle. It's metabolized to succinyl-CoA to succinate.
Right.
Well, succinate is actually succinate fermentation.
Okay.
That is coming from glutamine ultimately, and that will give tremendous energy to some of these cancer cells. So you have to shut that. You have to shut the door on that. And that's what we're learning now, and that's why you have to use combinations of these targeted drugs. And you can't do that alone by diet.
You can't do it by diet. You can't just say, I'm not going to eat foods with glutamine because we have so much stored.
This whole thing about, I've never said anywhere that a ketogenic diet would cure cancer.
Right.
It puts you on the path for resolution.
Yes.
But by itself, it probably will not. But that makes other things work remarkably
more effectively.
Well. And then you could potentially have resolution.
Yeah, absolutely. So you guys are hearing it from the top researcher on basically the metabolic theory of cancer, Dr. Thomas Seyfried here, and he's telling you, hey, put your body into that state of therapeutic ketosis, and it just allows your body, your own immune system, to be able to, basically be able to break down cancer cells, and then combining that with different therapies based on, your clinical state, your particular cancer, and what you feel most comfortable with, can be an effective strategy that you can utilize to help overcome cancer. And this is why we're doing research like this, to get this out to people, so we can save more lives, right?
Yeah,
and so, is there anything you want to leave the audience with? Any sort of thoughts or inspiration?
Well, I think that we have to realize basically that cancer is a metabolic disease.
It's a metabolic disease.
It's not a genetic disease.
Right.
And most of the therapies that we're using in the clinic, toxic radiations, all these things, they're designed to kill cancer cells by stopping their proliferation.
Right.
But if you take away glucose and glutamine, you can do the same thing without the toxicity, and very cost effective. This is another. Unfortunately, this may be the largest weakness of our therapy.
Yeah.
It's not, you can't make money on it, at least not yet. So these others are much more profitable.
Right.
But what is the biggest interest? Is it in saving people, or is it in making money?
Yeah.
So people have to come to make this decision for themselves.
Right.
But we have a pathway now, a pathway forward,
Yes.
where people, once they know how to do this, and once their caregivers know how to do this, we're going to manage this disease much more effectively than we are today.
Absolutely, absolutely.
It's just that simple.
Yep, absolutely. And so again, this is the author of Cancer as a Metabolic Disease, okay? And I know you're doing a lot of research right now. Tell us more about the foundation and how they can access that.
Travis Christofferson was one of the first to read my book.
Yeah.
And he was blown away.
Yeah.
And he said, well, how come nobody knows about this?
Right.
And he didn't believe a lot of the things that I said in there. But then he became like a journalist, and he went around and interviewed people throughout the country and in different countries as well, to see whether or not the things that I was writing were true or substantiated, and they were.
Yeah.
So then he decided to write his own book, Tripping Over the Truth.
Yep.
Which was what's going on in this cancer thing.
Yeah.
So then he set up a private foundation to collect funds that are used in large part to support our research through the university.
Yeah.
So the Boston College sets up grants with these private foundations, and they support my research through these private foundations. And that's a very traditional way to support academic research.
Yeah.
People cannot write me checks personally, and I go out and buy supplies. Can't do it that way.
It's through an organization.
It's through, because I am an employee of Boston College. My mission is to train and teach undergraduates and graduate students, and then the support that we get through the university comes from private foundations or federal government grants and this kind of thing, but it comes through the university. But Travis's foundation does have an ongoing research grant with Boston College, and therefore the funds come through Travis's foundation and other private foundations as well.
Yep.
So this is the way that works, because we do the preclinical testing. As soon as I see something that works, I call my clinician friends who are able to implement these, and then we start bringing it to the population. This is what we call bench to bedside. This is translational research the way it should be done.
Right.
Right? And we're seeing immediate success for so many patients because we've developed the best animal models for brain cancer and metastatic cancer.
Yep.
And it's very hard. People say you cure cancer in mice. You don't. When you have cancer in mice that's like human, it's just as difficult to cure this mouse as it is to cure the human.
Yep.
So we have the best models. We know what works, what doesn't work, and then we can make recommendations to the physicians as to what they should do. And the example of this is what's going on in Turkey right now, where in their clinic in Istanbul are using our press pulse concept to treat all these stage 4 cancer patients with remarkable success.
Wow.
So we can see the direct benefit of what we're doing.
Yeah, and stage 4, I mean, these are very fast-growing cancers. These are the hardest, okay? And so, you know, with his animal studies, they're showing that, hey, they're seeing results. Then they go, and this is the man who spends his time in the lab, right? And then he goes ahead, he contacts his clinician friends, they start putting it in action. So we're able to see, okay, it's working on the rats. How about, you know, with people, right?
Work on the mice.
Mice. I'm sorry, not rats, mice. And then, boom, now we start to implement it with people. Are we going to see similar results? Are we seeing results with it?
We've seen similar results with the dogs. Dogs with cancer.
Right.
They're just as responsive as humans.
Yeah.
So that's why it's all the same disease.
Right.
Same therapy works on dogs, works on human, works on mice.
Yep.
Right. It's one disease, one mechanism of action. It's a fermenting disease. Take away fermentable fuels, and you manage the disease. It's not that complicated.
Right.
We've
We've made it
complicated disease.
Yeah, absolutely. I just want to encourage you guys, if you are enjoying this information, you want to support Dr. Seyfried's research and really get this message out and ultimately just really apply this for yourself, then I want to encourage you to own the Keto Edge Summit for yourself. You'll get all the interviews, the transcripts, everything you need to be able to use for a lifetime at your own time and your pace. And if you'd be so honored to consider that, you know, ultimately we would consider that a great honor and a privilege. So God bless you guys, and we will see you in a future interview.